Hey guys, in this video I'm going to cover the pathology part of the blood vessel. So let's see first the structure of the blood vessel. Blood vessels have this endothelial lining. After endothelial lining there is internal elastic lamina, and after this there is smooth muscle. These are the smooth muscles, and if it is a muscular artery there will be smooth muscle, but if it is elastic artery there will be few smooth muscle and more this elastic fibers. So this is elastic artery. After that there will be external elastic lamina, and after that there will be this tunica extrema, and in here there is vasorum will be there. So blood vessels are divided into three parts: tunica intima, tunica media, and tunica externa, also known as adventitia. So these are the three parts of blood vessel. The endothelial lining that we have discussed, and this internal elastic lamina will come into this tunica intima. Then in tunica media, this elastin fiber or smooth muscles will come into this tunica media, and in tunica externa or adventitia, this external elastic lamina and vasa venorum plus fibrocollagen. This vasa venorum and this two will come. So this external elastic lamina, beneath this there is this fibrocollagenous layer that will also come into this tunica externa. These three structure we have to remember the most: internal elastic lamina, external elastic lamina, and this fibrocollagenous layer. This is muscular artery, this is elastic artery, as we have discussed. Now, first arteriosclerosis. So, what is arteriosclerosis? Arteriosclerosis means thickening. So, there will be thickening of the arterioles. Now, this arteriosclerosis has mainly two types: hyaline and hypoplastic. So hyaline will occur in benign hypertension and hypoplastic will occur in malignant hypertension. And the diagnostic finding is, in hyaline there will be pink glossy deposition of hyaline tissue, while in hypoplastic there will be onion skinning will happen. Why? There is also smooth muscle proliferation is happening. Here this just hyaline material, that is pink glossy, is deposited, but here smooth muscle proliferation is happening due to malignant hypertension. That's why onion skinning will be there. Now there is also third type, that is fibromuscular intimal hypoplasia. What will happen in this? So tunica intima plus tunica media thickening will be there, and that is end point of vascular damage, also known as restenosis in stent. In this condition there will be this fibromuscular intimal hyperplasia. From name you can remember, intimal means tunica intima plus tunica media is getting thickened. So So internal part of the artery, tunica intima plus media, is getting thickened and it is end pot of vascular damage. Now the Monkey-Buck medial sclerosis is a senile change. What will happen? Monkey-Buck medial, name says that is in tunica media and age related, means senile. And what will happen in this Monkey-Buck medial sclerosis? The calcification will happen and it will be type of dystrophic calcification. So these are mainly three type of arteriosclerosis: arteriolosclerosis, Monkey-Buck medial sclerosis, fibromuscular intimal hypoplasia, and the fourth one is atherosclerosis. So in atherosclerosis there will be chronic inflammation and it will heal by fibrosis. That will be our main pathophysiology. That what will happen due to this inflammation, it will heal by fibrosis, but the main stimulus which will initiate this inflammation will be endothelial injury. So there are certain risk factors which can increase the risk of atherosclerosis. So non-modifiable, modifiable, additional. So non-modifiable is genetic, age and sex. You can't change these things. So in age, with age you have to remember there is certain clonal hematopoietic cells of intermediate potential, that is TAT2 mutation. So TAT2 mutation will happen in this clonal hematopoietic cell of intermediate potential, and what will happen to these chip cells mutated? There will be increase in cellular progression and monocyte alteration. That's why they are converted into pro-inflammatory kind of cell, and that will cause damage to the blood vessels. Now modifiable risk factors are hypertension, diabetes, smoking and hyperlipidemia. In hyperlipidemia there is one thing, that lipoprotein A LDL oxidase has this excess of ApoA and ApoB will cause damage to the blood vessel. How? It will inhibit the plasminogen, so increase in fibrin will lead to thrombus formation. So these two mechanisms, oxidized LDL increase damages blood vessel, and lipoprotein A excess of ApoA and ApoB will inhibit the plasminogen. That's why increase in fibrin formation leads to thrombus formation. Now additional risk factor are pro-inflammatory stage, increase in CRP, infection like herpes, cytomegalovirus, chlamydia, and increased stress also. Now the pathophysiology part. So if there is a turbulent blood flow, it will cause increased risk of atherosclerosis, cause endothelial damage will be there. How? Let's see how this turbulent blood flow will cause endothelial damage. So at the bifurcation there is Kruppel-like factor 2 will decrease. It will lead to increased inflammation and increased atheroprotective gene. So this atheroprotective gene will decrease and inflammatory markers will increase due to this Kruppel-like factor 2 decrease. It will cause endothelial damage. So all of these factors that we have learned, that this pro-inflammatory conditions, all hyperlipidemia, all are just leading to damaged blood vessels, means increase endothelial injury chances. So this endothelial damage, what will happen, that monocyte and LDL both will go into this blood vessel. So monocyte will convert into macrophage and it will engulf the cholesterol, and this LDL, that is oxidized LDL, so by the toll like receptors it will enter into these macrophages that have entered, and after that we know that from the pro-interleukin 1 beta is converted into interleukin 1 beta in the active form by inflammasome. So this is which type of apoptosis? This is pyroptosis. In pyroptosis we know that this inflammasome will cause activation of interleukin 1. So this interleukin 1 is getting activated and there will be fever. Now this oxidized lipoprotein lipase will also cause lysosomal damage in the form of cholesterol crystals. I mean, it will stimulate the lysosome, that's why damage will happen. In microscopy we can see the foam cells that are yellow plaque, and after that, due to healing process, all this growth factor will increase, tissue growth factor, fibroblast growth factor, and platelet derived growth factor, and it will cause increase in fibroblast, extracellular matrix, and smooth muscle proliferation, and this all lead to this thrombus formation.